my name is Shanice. I am a student at ECPI's Medical Careers Institute for their Bachelor's of Nursing program. I will be doing a presentation today on tobacco abuse, substance abuse, and how those two abuses affect our community. So first off, I want to start by saying that there are many different types of tobacco products out on the market. Cigarettes, cigars, beedies, smokeless tobacco, wrapping papers, as well as electronic cigarettes are all examples of tobacco products. Beedies, they're small, hand-rolled cigarettes that are usually imported from India, and they are usually tobacco that is wrapped in a very thin leaf plant that's secured with a colorful string at either one end or both ends. Smokeless tobacco, an example of that would be your chewing tobacco, the dips that a lot of people, mostly our teenage and younger males, tend to get into this. They actually take the tobacco and they chew it and they spit the tobacco out of their mouth along with the juices that build up in their mouth from chewing the tobacco. The smokeless tobacco is a very well-known cause of cancer, and it causes oral cancer and pancreatic cancer. Some health consequences of smoking or using tobacco products range from going blind, issues with fertility, can cause lung cancer. Smoking in general can cause many different types of cancers, such as throat cancer, mouth cancer, cancer in the nasal passages, stomach cancer. Pancreatic cancer is not only caused by the smokeless tobacco, but it can also be caused by smoking inhalation. Kidney cancer, bladder cancer, cervix cancer, and smoking is very, very, very closely linked to causing colorectal cancer. So your cancers of the colon, the rectum, the anus can all be caused by smoking. Smoking can also cause gum disease, which can lead to loss of teeth in adults. Actually, it's one of the most common reasons that adults lose their teeth. If it's not due to natural causes at a very, very, very older age, it is usually due to smoking. Smoking can definitely cause gum disease that affects the bones in the mouth that actually anchor the teeth into the gums. Therefore, you will have tooth loss. Men specifically can suffer from erectile dysfunction at an early age due to smoking. So in order to reduce that risk, one would need to quit smoking. Women can develop ectopic pregnancies or have fertility issues due to smoking. So again, in order to decrease or reduce that risk, women would need to quit smoking to reduce those risks. Smoking during pregnancy can cause many issues, not only to the mother but to the unborn child as well. And one of the bigger commonalities we see with that is a cleft lip and a cleft palate that affects the unborn child. Now, here are a few multiple choice questions to see if you have indeed gained any knowledge from this portion of the presentation. The answer to this question is all of the above. The answer to this question is A and C. The answer to this question is erectile dysfunction. The answer to this question is both A and B. The answer to this question is cleft lip and cleft palate. The answer to this question is colorectal cancer. Next, I would like to talk about heroin abuse, opioid abuse. Um, Heroin is not legal in any of the 50 states. It is very illegal in each and every state in the United States. Some side effects of the use of heroin that one could experience would be severe itching, a trance-like state, nausea, vomiting, and slow breathing. Common signs of opiate or opioid abuse would be ignoring or avoiding loved ones, stealing money, faking pain-related emergencies just to get to a hospital, knowing that they would be giving you drugs in order to treat the quote-unquote pain emergency that you're going through. Long-term effects of opioid abuse could be blood infections, addiction, respiratory depression, vein collapse, and dental problems, just to name a few. The physical dangers of heroin abuse would be contracting HIV, which can then turn into full-blown AIDS, developing liver disease, such as your hepatitis, depression, skin infections from the use of needles that are not clean, pulmonary infections, kidney disease, just to name a few. The prenatal risk of opioid exposure during pregnancies are infant opioid addiction, preterm delivery, infant withdrawal, abnormal infant interaction with visual and auditory stimuli. So your child may not respond as normally to your voice or to seeing you as they would had the mother not used heroin or opioids during her pregnancy. Now, here are a few multiple choice questions to see if you have indeed gained any knowledge from this portion of the presentation. The answer to this question is all of the above. The answer to this question is 0. The answer to this question is all of the above. The answer to this question is both B and C. The answer to this question is infant opioid addiction. The answer to this question is all of the above. Now, different ways that tobacco abuse and substance abuse can actually affect our community would be secondhand smoke, an example of the use of tobacco products, smoking. Secondhand smoke has two primary effects on adults that actually do not smoke. It can increase their risk for heart disease, and it can actually increase their risk for lung cancer. And all they're doing is inhaling the smoke that somebody else has put into the atmosphere because they choose to smoke. Secondhand smoke can also cause an increase in asthma attacks, respiratory infections, ear infections, coughing, sneezing, and shortness of breath in our children. So again, our innocent children that just so happen to be in the same environment as somebody that's smoking can develop respiratory infections or have these symptoms of coughing, sneezing, and shortness of breath because somebody else is smoking within their vicinity. Now, third-hand smoke is something new that has just been put out there. It is not the same as secondhand smoke. Third-hand smoke actually is related to the invisible gases and particles that are left over from the tobacco smoke. These particles, they're toxic and they tend to cling onto skin, hair, clothing, furniture, just about anything in the room that it can cling to. So that whole I'm going to smoke my cigarette and air outside for 5 or 10 minutes, those third-hand particles are still stuck to your clothing. So when you come inside the home, those particles are still getting attached to the furniture, the curtains, the carpet, wherever they can cling to. Heroin abuse affecting our community. An individual that is on heroin can exhibit different characteristics such as the inability to maintain an honest relationship, unpredictable behavior, dangerous behaviors. So here we worry about domestic violence, and they can potentially exhibit financial instability due to them trying to find a way to pay for their addiction, to supply their heroin to keep their addiction afloat, which then leads to heroin addicts committing crimes. They're not committing crimes because the drug itself is making them do it. They are typically stealing just to get enough money to pay for the heroin to support their addiction. And it has been shown that heroin is one of the most deadly drugs that are out there, and we have to definitely keep our community safe. The opioid addiction and the heroin addiction is spreading worldwide, and it's getting worse day by day. So definitely would like to get the word out there and let everybody know about this. The answer to this question is an increased risk of lung cancer to non-smokers who are exposed. The answer to this question is all of the above. The answer to this question is invisible gases and particles which are left over from tobacco smoke. The answer to this question is all of the above. The answer to this question is they are trying to pay for or support their addiction. The answer to this question is heroin. Thank you for listening to this presentation. I thoroughly enjoyed this. If you would please take a couple of minutes to complete the post-presentation survey, I would greatly appreciate it. Thank you, and you have a good day.